How was yesterday?
Good. I just felt more sore than usual.
It was intense, right?
Right.
So we were supposed to see you guys in the evening, but I gave you guys the evening off just because it was, we went pretty deep and something told me give them that time. How was your sleep yesterday?
Way better.
Good. Did you go for a walk?
Yes.
Everyone's doing good?
Yeah.
Bro and Dad are doing well too?
Yeah.
So we're going to bring Bro and Dad in hopefully after you today. And I want to talk about a couple of things today. And I want to talk about genetic predispositions versus familial tendencies. You guys, 3 of you came, not just you, right? You came the whole family. Yeah. So Dad brought daughter and son and knew that there were some physical or structural things going on. And it turns out you had a lot of stuff going on, which we kind of deciphered. But what was interesting in the 3 x-rays when we're analyzing it, the 3 of you have very different misalignments in your foundation, but your lateral film looks almost identical. And I talk about this historically about what's the difference between genetic predisposition and familial tendencies. Okay, so what are the genes? And I'm not discounting or discrediting genes. Genes are a blueprint, but we need environmental cues also to activate these genes, right? Okay. Now, what's a familial tendency? Meaning, we all sit the same watching TV.
Right.
We all sit the same at the dining table. We all sit the same in the car. We all don't walk. We all, it's like the habits and tendencies are similar, and so those habits create similar postures. And Stanford did a study. Stanford did a study and found your body will acquire the position it's most in within a 5 to 10 year period, which means, let's say I'm sitting like this for 5 years. My ligaments are going to adapt and I'm going to be like this. Does that make sense? So we're changing those habits. Energy?
I usually, before all this, I would wake up super tired and the whole day just super tired, no energy, and by like 6 I was done for the day. And now I wake up with energy and I don't feel tired until 8 or 9, which is crazy because that hasn't happened in a while. So that was exciting.
But what did you come here for? Number 1.
Headaches and dizziness.
How is that?
I haven't had a headache since last time, so I think 2 days now.
Okay.
Which is the most I've gone for a while.
Okay. For a while means what?
Since February.
Okay. So
that whole 5-month thing.
Okay.
Dizziness is still a little bit there, but now it's not the whole day.
Okay.
It's kind of just in periods. So.
And what's the number 1 thing you learned on this trip thus far? About yourself, about your body, about life. Give me the first thing that first thing that comes to you.
Just how important the spine is and how it's all your posture, everything. Just it matters.
It does, right?
Yeah, it affects everything else.
So when Mom and Dad say sit up straight, there's value.
Yeah.
There's a lot of value to it.
Yes.
There's a saying, posture is a window to your spine. The spine is a window to your health. Yeah. And let's talk, I want to just show this picture real quick. Come over here, please. Come over here. This is an interesting quote. Look well to the spine for the cause of disease. Hippocrates. In medicine, you take the Hippocratic oath. Above all, do no harm. Above all, do no harm. Okay, what else?
I've noticed my posture is just, I didn't notice how bad it was, and I kind of lacked confidence because of that, because I was always
hunched,
hiding, But now it's everything's opening up.
You were hiding because of pain?
I don't know.
You don't know?
Yeah, so I always felt but now it's everything's opening up and I walk straighter and I just feel better.
Awesome. Any questions before we start?
I asked about the swelling. So when I used to go hiking, I would just start swelling 30 minutes in, my hands, and I couldn't do a closed fist.
Hiking meaning you were in the mountains hiking or just trails even?
Let me rephrase that. Just when I would walk anywhere, basically.
Okay.
Sidewalk, anywhere, 30 minutes in, I noticed it start to swell.
Prior to coming here?
Yes, before here. And then
now?
I've been walking a lot and I haven't.
How you've been walking 30, 40 minutes, up to an hour even?
Yeah.
No swelling? Pretty cool, right?
Yeah.
Okay.
That's crazy.
Cool. It's all crazy.
All right.
Let's get started.
Okay.
The marks are getting better. Go ahead and walk for us. Let's see. Day 4. Awesome. She's got a swing. Now I want you to consciously bring the shoulders back. There you go.
Yeah, before
Roll them like this and hold them back. Like that. And then walk. It's not how I'm going to have you walk all the time. I just want to see the low back when you do that. Okay. Now just regular walk. Don't think so much about it. Go and touch the nervous system poster, please.
Oh.
Yep.
Touch it?
Just touch it. Yeah. Okay. Keep going. Keep going. All right. All right, we got to keep continuing, okay? So the movement is better. It's a little smoother. Definitely the number one thing I see is the confidence in your walk now. You're not guarding. Okay? So today we'll check spine. After spine, whatever extremities we need to do. Then we're going to do some soft tissue work, okay? Let's get started. I want you to go ahead and touch your toes, please. Okay, and I just want to follow, head down, head down. And just want to follow my fingers, okay? Just follow my fingers. I'm making it a little bit red just to see the spine contours. Okay. More tender there or there?
No.
The bottom one, yeah? Okay, come up slowly. All right. Starting at the base, everything is looking clean. Not getting any readings, maybe a 1-point flutter. That's good. Difference in the digestion the last few days?
Yeah.
Yeah. Okay. Little 5-pointer there. Around T4, T5. Never mind, it's washing out. Good. How's the rib feel in the front today?
Better. I noticed, and it's not the left side's not sticking out as much.
Good. I'll take a look at all that later, okay? Pretty cool. We're going to continue on the adjustment of the feet. After that, we're going to do what's called guasha, or scraping of the scar tissue, okay? And it is going to maybe scar a little bit, meaning have some blemishes for a few days.
Okay.
I talked to Dad and Bro already. They're going to get it as well. So we're good with that. Tell me what's been different in the ankle.
Well, I noticed that they were just kind of going in,
Okay.
especially when I walk.
Okay.
And so now they're just like...
They're not going in as much?
Yeah, not as much.
Okay. So we're going to work a lot of the scar tissue, again, as much as you can handle. Doing what's called working the periarticular swelling. Periarticular swelling is the swelling outside of every joint or a joint. And the way you work it, you always work it towards the heart. Okay? After periarticular, we're working intra-articular. Intra-articular happens through passive range of motion. 5, 4, 3, 2, 1. Good. Now let's do the other side. 5, 4, 5. And again, when you're doing this, you're just getting all that swelling. Work it towards the heart, into the joint, and up for the ankle. And you can feel it on both ends. Now, what happened, we did do your ankles the other day, and I was going to do the speeder board, right? So I ended up pulling it because I felt that it was there. I didn't feel we were going to disrupt. This one is bad. 5, 4, 3, 2, 1. Now we want to do passive range of motion. 5, 4. As I'm dorsiflexing the ankle, I'm pushing A to P on the dome of the talus with the web, with a web contact. 4. I don't expect you to know what I'm saying. I'm just giving good information out there, okay? 4, 3, 2, 1. All right, now this side. 5, 4, 3, 2, 1. Okay. Now let's go ahead and set them. AS Talus, medial tilt. Home run. Nice and clean. AS Talus, medial tilt. Nice and clean. Very nice. Stand up and walk, please. And then I'll continue.
My feet never been hot like that.
What you talking about? Now, the other thing I want us to notice when she's walking, she's definitely walking better on the heels. And this is going to be a lot of practice. We talked about the low back and that scar tissue, right? I'm not expecting 100% on this trip. We know there'll be some follow-up down the road. Okay. All right, have a seat. Slowly open. Slowly close. Open. There's a tiny bit there. Tiny bit. Want me to work on the nose today?
You can work on the nose?
Yeah, we have a slight deviated septum there. Do you feel that?
Yeah.
That side is okay. Are you able to take the nose ring off?
Yeah.
I can work on it then.
Yeah.
Okay, slowly open. Open, open, open. Let's go ahead. We're going to set this right side lightly. Then you take the nose ring off. We do the nose, okay? Go ahead and open up. Open, open, open. Open all the way. Slowly close. There. Open. Nice. Close. Go on your back, please, and take your nose ring off. If you want me to work on it. That's the bone. Okay? And when I push here versus here, this side is a little softer, right?
Yeah.
This side is hard.
Mm-hmm.
Breathe in through the left nostril. Breathe out through the left nostril. Breathe in through the right. Breathe out through the right. Okay. So what I'm feeling there and seeing, it's on this side. Do you feel that?
Mm-hmm.
That's the septum cartilage. That's the bone. I'm not touching the bone.
Okay.
Okay, meaning I'm not adjusting or cracking a nose bone. You got it?
Yeah.
Raise your head, please. Chin down. Good. I'm grabbing the nostrils. Breathe through your mouth, please. All the way over. You're okay, right?
Yeah.
Yeah. And I got it. Home run.
Ugh.
Breathe. Check it out. Breathe. Stay there, please. Let's see the rib. You still have swelling. It's not just the rib. Does that hurt the same?
No.
It doesn't hurt.
Mm-mm.
It's just swelling now. That's part of your healing process, okay?
Yeah.
That's good.
Yeah.
Awesome. What do you think, Shasha? Pretty good, huh? From day one?
Yeah.
We just remodeled her. It's like the bionic woman. Okay, it's looking good. Let's continue. Guasha. Let's go on your back, please. The bone comb, that's what I call it. It's something I came up with the name, but this was taught to me by a massage therapist when I was an intern. We need to work on your biceps and shoulders, so we're going to raise this up. That's okay? On both sides.
Okay.
After we do that, we're going to be doing this side, and peronei. This is the peroneal muscle here on the sides. This is the IT band. We're not doing IT, we're going closer to the origin of the hips because you had asked me about the hip dips. Now, when we look at the hips, we have a lot of origin of muscles at the hip socket, right? G medius specifically, IT band, the glutes, all of that. So if it is tight, you can't expand. Muscle will only grow according to fascial expansion and contraction. What is fascia? Fascia is the connective tissue that compartmentalizes the muscle. It gives it its shape, right? So you know, like when you eat a steak, if you eat a steak, no hate on the vegans. When you eat a steak, you know the white film that covers it? That's fascia. Okay. If we have scar tissue in fascia, which I know we do from structural misalignments and adaptation, we need to work that out. Otherwise, the muscles will only develop in that constriction. Does that make sense? Yep. Okay. So first thing, let's come over here. Now, why am I doing up here for you?
Because my shoulders are still.
Because you've had rounded shoulders for how long? Forever. Now, this is guasha. What we're doing is hard comb on a soft surface. It should be a smooth feel when we get to the grit, like right there. You feel that?
Yeah.
It's gonna mark a bit, okay? Bear with me.
Okay.
There we go. Yes. There we go. 5. You may need to wear 5, 4. There's a lot of grit in here.
Yeah.
Breathe through it, please, the best you can. Good. 5, 4. This is something you can also do for yourself every 5-6 days. I'm going to give you guys some combs when you go, okay? And you can do this. I actually encourage you to do it for yourself.
Okay.
Or you guys can switch off. 5, 4, 3, 2, 1. Listen. That's the grit. Breathe through it, breathe through it. Okay, it is bruising a bit.
Okay.
All good. 5, 4, 3, 2, 1. Starts off as a tickle, right? All good. What's that?
And then it starts hurting.
You can handle it, right?
Yes.
Okay. So I have to do this to your leg too.
Ugh.
It's going to be fun for you. 5, 4. Now, obviously, I'm going to your tolerance. I can go a lot more. I'm not. 5, 4. Side. 5, 4, 3, 2, 1. Almost. Right in there. Push that there, please. Thank you. Using this side now. Dig in. 5, 4, 3. I don't want to see those round and forward shoulders next time, okay? I don't want to see it. 5, 4, 3, 2, 1. Okay. Hear that?
Yeah.
That's all the grit, scar tissue. 4, 3, 2, 1. I'm going along the peronei muscle. This is the fibula. Peronei muscle starts back here, goes along the fibula, and then comes down over. It's responsible for plantar flexion and eversion. It's part of the walking mechanism, okay? Now you see when I do this, we're decent, right? Okay. As soon as I go this way, you can feel it. Are you okay with this?
Yeah.
Okay. Sorry, can you handle it?
Yeah.
Got it.
So.
If you, any reason, just tell me to stop if it's too much, okay? Please. 5, 4, 2, 1. 5, 4, 3. Oh yeah, there it is. You see what I'm doing? This is the hamstring. It's the lateral head. See? Mm-hmm. See? Mm-hmm.
Oh, that one hurts.
Yeah. And I need to do this before we do any exercise on that we talked about, okay? Now, I want to focus more on the back. 5, 4, 3, 2. There it is. That's what I want. 5. You can handle it. 5. 4 more. 3 more. 2 more. 1. Same thing, working peronei. Now remember, Jasmine, you're going to do this at home too, okay? Every 5 days. And you can go back to the video, do exactly the same thing. Okay? You feel all that grit?
Yeah.
5, 4, 3. Oh yeah, there it is. Achilles. Achilles. Achilles.
Yeah.
5, 4. You're okay, yes?
Yeah.
Good. There it is. I'm on the back side of the hamstring at the insertion of the knee. At the insertion of the knee. Mm-hmm. This side's more bruised. 5, 4, 3, 2, 1. Right there. Okay, towards the heart. Towards the heart. The best you can handle, okay? If it's too much, tell me. I'll stop. 5, 4, 3. Now, this is swelling. This is all swelling, Shasha. This is swelling that needs to come out. This. Okay. 5, 4, 3, 2. 5, 4, 3, 2. That's it. 5, 4, 3, 2, 1. Now, this is going to be on the outside of the gown, okay? I got to get in here. 5, 4, 3. There. 4, 3, 2, 1. Other side. Right there. 5, 4, 3, 2. That's it. You're done. Torture's over, okay, for today. Shake it out. Good? Okay. Squeeze my hand. Squeeze hard. Solid. Squeeze. Solid. Elbow. That's it. Squeeze. And squeeze. Stand on your right leg.
Oh my God, I had a thing.
Muy bueno. Eyes open 2 minutes each side.
Yeah.
Every day. Do the left side. Enjoy your day. We're all set for today.